cumulative impact? So that's a great question. So the gene mutation at the current time cannot be prevented, right? So it's not something which, well, I shouldn't say that. Sometimes if you know about it and if you're pursuing assisted reproductive technologies, and let's say a couple knows one person is carrying a particular gene mutation, let's say they're pursuing IVF or some other assisted reproductive technology, the technology does exist to do what's called pre-implantation genetic diagnosis. So you can actually select for embryos that don't carry the mutation. So it's not really preventing the mutation, right? But it's more of a selection process. But I'll say that that's obviously a very intensive process, a very personal process that's not accessible to everyone, but just the technology does exist. If we're talking about the actual cancer, right, the actual cancer development, that's a different story. And that is very dependent on, again, what gene mutation, what cancer risks we're talking about in a particular family. So I'll use BRCA as an example, just because it's one of the more common ones, hereditary breast and ovarian cancer syndrome. So if someone does test positive for that, if they do carry a BRCA1 or 2 mutation and they have an elevated lifetime risk for breast and ovarian cancer, there are preventative measures that people can take. So someone could pursue what's called a prophylactic or preventative mastectomy, so removal of their breasts, and or pursue surgical removal of their ovaries as well. So that's about as close to prevention as we come, is surgical removal of those organs that are at risk. And again, depending on what screening we might have available, in that example, we have very good screening for breast cancer that can detect cancer early. So not every patient would necessarily choose to the prophylactic mastectomy. But on the ovarian cancer side, we have very limited screening techniques. And so it's actually written into guidelines that women, once they're done having their children, once they're closer to the natural age of menopause, very strongly consider surgical removal of the ovaries, again, to prevent that cancer from developing. And that's a specific example